Hi, my name is Brett Ballesteros, and I'm here to talk to you about a blood disorder called ITP. ITP stands for Idiopathic Thrombocytopenic Purpura. ITP is a blood disorder in which, for an unknown reason, your body destroys its own platelets. The reason I did this research is because my sister was diagnosed with this disease 5 years ago. Her platelet levels have never been severely low, but I thought it would be very interesting to learn about her disease and how I could potentially help out her and help out others. Let's first take a look at platelets. Platelets are one of the most important elements in your blood. Usually the platelet count in your blood is anywhere from 130,000 to 400,000 microliters. Platelets have many functions, but most importantly, they are involved with the stopping of blood loss by clotting. When you start to bleed, your body performs 3 steps to stop the bleeding. These steps are vascular spasm, platelet plug formation, and coagulation. Vascular spasm is a quick constriction of the blood vessel. Platelet plug formation is when platelets go to the exposed collagen fibers of the broken vessel wall. Blood clotting is when platelets form a barrier and it gives the broken vessel time to repair itself. Now, let's take a look at ITP. ITP is a blood disorder in which the person has an unusual low platelet count in the blood. The normal platelet amount is considered to be anywhere between 130,000 to 400,000 per microliter. For a physician to diagnose a person with ITP, the patient must consistently show low platelet counts. Though having low platelet count is dangerous, it is not considered a medical emergency until the person reaches below 20,000. Our body produces antibodies that are supposed to protect us from foreign antigens, and someone who suffers from ITP, for some unknown reason, the antibodies that are supposed to protect us react with platelets, which lead to their destruction in the spleen. Thus, the amount of platelets will drop. The low platelet count will cause the individual to have a very severe bleeding because of its inability to stop the bleeding. Now let's look at a few signs and symptoms. There are really no signs and symptoms for this condition because you will feel perfectly normal. That is why it's so important to maintain a regular blood test schedule. Some usual signs, though, are very easy bruising and bleeding. It is hard for the average person to tell that they are bruising easier or bleeding more because it seems perfectly normal to us. This picture shows an example of purpura, or more commonly known as bruising. Lastly, let's look at treatment for this condition. Usually a person will have no treatment for this disorder until their count is below 20,000 platelets. Some of the treatments include injections of high-dose gamma globin, drugs that suppress the immune systems, drugs that filter out antibodies, and anti-RHD therapy. In more severe cases, treatment such as a splenectomy or a platelet injection may be used. A splenectomy may be used because usually the platelets are destroyed in the spleen. Taking out the spleen would stop the destroying of platelets. A problem with a platelet injection is just like their own platelets, new platelets will be destroyed in your body. Thank you for taking your time to watch my video. Hopefully you learned something from it. If you would like to continue learning about ITP or donate money to continue the research of this condition, please visit itpsupport.org.uk. Thank you.